Welcome. I'm Jane Partridge, co-president of the League of Women Voters, Lake Forest, Lake Bluff. For those of you who may not know, the League of Women Voters is a national organization with over 800 local and state chapters. We encourage both men and women to join us. If you are not a member, there is information on the table. The League is a nonpartisan political organization which works to increase understanding of major public issues and influences public policy through education and advocacy. We have educational programs throughout the year and hope you can attend some of our future ones. Watch our website for more information. Our website is www.lw-lflb.org. We are very pleased to be hosting tonight's program, Obamacare, Just the Facts, Part 2. We had Part 1 last spring at the First Presbyterian Church. Some of you may have attended our program last spring, but with tonight's follow-up program, we will be getting into the specifics of the health care insurance options. And I want to thank the Presbyterian Church for hosting us. They've been very, very helpful in getting this together. So now Melanie Rummel, where is she? Oh, there you are. Melanie Rummel, one of our members, will introduce the speakers and explain how the forum will work. Melanie?
I feel like this is the press corps or something with all these microphones. Thank you, Jane. I'm pleased to facilitate tonight's program, Obamacare, Just the Facts, Part 2. It's always a pleasure to facilitate any of the League programs. Let me briefly go over how the program will work. First, our three very knowledgeable speakers will speak about their roles in providing health care in Lake County. They also will address the who, when, where, and how of the Illinois health insurance marketplace. After their presentations, I will take questions from the audience. I think we're just going to let you raise your hand and ask me, and if it needs to be rephrased, I'll rephrase it to the speakers. Does that work all right for you, Mary? Okay. If you have a more personal questions, the speakers will stay a while after the program is over, or they can make appointments for you to come in and speak with them. Tonight's program is not a discussion about the Affordable Care Act. Instead, we will be learning about the options available. Our first speaker is John Shustitsky. He is the Chief Executive Officer of the Alliance for Human Services in Lake County. The Alliance is a coalition of organizations working to improve the quality of human services in Lake County. Along with John, we have Stuart Kerr, who's in the front row here. Stuart has informed me that he's new on the job as the Lake County, as the executive director of the Lake County Chamber of Commerce, and he's here. He's also trained as a navigator. Next, Tony Beltran will speak. Tony Beltran is the executive director of the Lake County Health Department and Community Health Center. The department was established in 1956 and now has over 1,000 professionals helping in the daily mission of health promotion, illness prevention, and the protection of the environment. It is the largest human services provider in Lake County. And our last speaker is Ann Flanagan-Bassey. She is the current supervisor of Moraine Township. Ms. Bassey is a marketplace navigator and has undertaken extensive training to help people enroll. Also, I'm pleased to acknowledge that Ann is a past president of the League of Women Voters of Highland Park. And now for this evening's three speakers. After they have finished with their presentations, I'll be taking your questions. Just for your information, the program is being video recorded and will show on the League's website, on public access television, and on YouTube. I wonder how many hits we get from those. John, do you want to start off the evening's program?
Yes, thank you, Melanie, and thank you to the League for your invitation tonight. I appreciate the opportunity we have to talk about an important project here in Lake County. Just as the League is committed to coordinating and improving complete participation of all in the civic processes in the community, I'm pleased that I'm part of the Alliance for Human Services, which is a newly formed organization designed to pull us all together in promoting a healthier community with a strong system of human services that improve the quality of life for every one of our neighbors, those who rely on the public system, those who live here and do not need to rely on that system, but we're part of a large organization that is new and growing. The Alliance for Human Services was created due to the initiative of the Lake County Community Foundation. That foundation invested some of its resources in creating some capacity building opportunities for the human services and healthcare nonprofits in Lake County, as well as some of the departments of local government. After a 2-year process of leadership development and capacity building initiatives, the Lake County Community Foundation supported the leaders of that initiative, the 25 executive directors from local community organizations, in forming an ongoing alliance. I was pleased when the alliance selected me to work with them about a year ago. We're now an organization of 27 healthcare and human services organizations throughout Lake County, and our goal is to improve the quality of life for all of our neighbors, to improve the level of cooperation and coordination among our agencies, to make it as easy as possible for folks to get the care that they need, to find ways that we can advocate together for better services, and that we can make it as easy as possible for those who enter service with one of our organizations to move smoothly to other organizations that might provide services they need. On the table outside is a list of our goals and objectives and our 27 members. It is a list of the community resources you've come to know and support, including Catholic Charities, the Lake County Health Department, PADS, Mano a Mano, Youth Build Lake County, Rosalind Franklin University, many organizations, and together we're working to improve our level of collaboration and cooperation. I was delighted when Tony Beltran and his colleagues from the Lake County Health Department invited us to a partnership to serve those who are going to be eligible for the Affordable Care Act. This process began about 6 months ago. Together we've worked to develop a network of community resources to help our neighbors learn about what might be available to them through the Affordable Care Act and to make that process as easy as possible. Of our 27 members, I believe about 14 organizations are already directly involved in the enrollment process for our neighbors, and all the others are involved in making referrals and helping us connect with those in the community. I will just close my brief remarks by thanking again the League for your hospitality, thanking my friend and colleague Tony and my new friend and colleague Ann for their work to help us find the way to make sure that all of our neighbors are well informed and have the opportunity to enroll in the new benefits through the Affordable Care Act. I also encourage you to take our flyer. There's a good chance that many of you serve on the boards of directors of our organizations or are aware of organizations in the community that ought to be aware of the Alliance. Please make those connections for us. We look forward to continuing to grow and improve the cooperation and collaboration among the organizations here in Lake County. So thank you.
Thank you. Tony Beltran will speak to us next. Remember, he is the Chief Executive is the Executive Director of the Lake County Health Department for the community. You want to stand here?
Yeah, I think that'll be.
That's perfect. Go ahead.
And you'll have a chance to sit down as well. Yeah, which is nice. So thank you, John, for starting us off tonight. You know, I was excited when the League invited me to come and speak. Talking about expansion of healthcare is something I could talk about all night. Luckily, they also gave me a time limit, so I won't be speaking to you guys all night. But I am going to talk about, about quite a bit. As was mentioned, I am the executive director of the Lake County Health Department, which we've been around for quite a while. Initially, our focus was on population growth and development in 1959, but since then, we've really expanded kind of the work that we've done. We started with 20 staff and a few programs, and now have over 60 programs and about 1,000 individuals that we get a chance to work with every day. And our focus has also changed, so really focused a lot more on providing service to those that need it, including focus on behavioral health services, primary care services, and prevention services through our large network. We are a federally qualified health center, and if you don't know what that means, it's for us it's a network of 6 clinics that we have that serve uninsured and underinsured individuals throughout the county. Those locations range, and we serve each year about 45,000 individuals and providing them primary health care services. Of that, about 20,000 of those individuals do not have insurance. And so we're excited with the expansion of healthcare because we know that many of them will actually qualify for expanded service. And although we're providing them basic service, they'll have an expansion of access to services that they currently do not have. Those locations also serve as important locations for individuals to come and receive services about healthcare just in their community. Recently, we had someone walk into our North Chicago location. She's a security guard that works in Waukegan, and she said she was waiting for that day. She came up and said, I want to talk to the person that knows about health insurance, that has that information. She had told the person when she met with them that she had been waiting for that day to sign up for insurance because she was really excited about that opportunity. She hadn't been to a doctor in over 8 years, and although she thought she was healthy, she said she wants to make sure, and more importantly, she wants to stay healthy. So she said, I need to, sign up. Within a couple of days, she was able to sign up for insurance completely, and actually is going to be one of those individuals that on January 1st is going to have health insurance through this new process. So we're really excited kind of to see how this is really impacting, people. At the health department, one of the things we focus on is that increase to healthcare. So it really is part of our mission. The current healthcare system really doesn't focus on healthcare for those that are underinsured and leaves that gap there. If you have great insurance, you can get great care in the U.S., but if you don't have insurance, it's you struggle with challenges to get that same coverage. In Lake County, we have about 71,000 adults that are uninsured. So they'll qualify for some kind of coverage, many of them through this program. About 21,000 of those 71,000 won't qualify because of residency status in this country, but that still leaves us over 50,000 individuals that through this program are actually going to have access to health insurance that may not have been able to either afford it or known how to get that insurance. Through Enroll Lake County, our goal is that we would enroll over 21,000 of those 50,000 in healthcare coverage over the next couple of months. They have until the 31st of March in this first wave to enroll in healthcare coverage. And so the way it works is there's actually 3 different kinds of plans. For people that are up to 138% of the federal poverty level, they'll qualify for Medicaid. So they'd be able to get to that expanded coverage and qualify for Medicaid without having to pay for that coverage. So those that aren't working, we know a lot of people have been hit by the economy and don't have jobs right now. So any kind of coverage might seem out of their reach, but for those individuals, they'll qualify for this plan and be able to afford it since it'll be covered. For the next group of individuals, which is actually a majority, so out of that 71,000, 34,000 of those will go into that next category, which are people that will get insurance, so between 100 and 400% of federal poverty level, they'll be able to get insurance, and it'll be subsidized through the federal government. So it'll be a commercially based plan. There's a couple of them that are on the marketplace. Just to give you a sense of what those numbers mean, that's about someone that makes $15,000 all the way to $45,000. And the way that the plans will work is they'll actually be able to sign up for that health insurance coverage, be able to get it, and they won't have to pay more than 9.2% of their salary. So there is a cap on what they would actually have to pay out of pocket for this coverage, which is great. I'm not going to talk as much about some of the details. Anne is certified also in this and knows a lot more details, but I'll give you the general talking points. But then there are also people in that category that are above that 400% of federal poverty level, and they'll also qualify for this expanded coverage. They're guaranteed to get that insurance. They won't receive some of the subsidy and benefits for that, but they'll be able to apply for the plans. And they'll be able to do that without some of the prohibitive structures that are in place right now in terms of getting it. So the pre-existing conditions in buying insurance are over, and we think of pre-existing as really complicated kind of things. Someone that maybe has had lots of complications with diabetes, or they've had cardiovascular disease. But the reality is, for families, a pre-existing condition, to price them out, could be one child with asthma, because the insurance companies know they might need to go to the hospital if they have an asthma attack. So for those families, they might not be able to have coverage. So this will get rid of it. One of the other things that it will allow is it's going to get rid of gender-based pricing. So right now, the way the current structure works, if you go and buy insurance, women actually pay more than men to get their coverage if they're purchasing their insurance. And why is that? Well, women are better at using their insurance. They're better at going for preventative things. When they're in their 20s and their 30s, they go and receive preventive care. As men, we go when we're in our 50s and 60s, and we have to go. It's not a choice, but we need to go. So right now, women actually end up having to pay more for their coverage. That actually is gone. It no longer is a criteria that will be factored in when you're purchasing coverage on this marketplace. So that's really exciting. The other thing is the plans will actually require that there's a minimum level of services. So there's essential benefits that are required. And some of these benefits, for those of you that have insurance, or you'll think of them as kind of basic. They're not extraordinary things. So things like outpatient doctor visits are covered. Emergency room visits are covered. Hospitalizations are covered. Maternity care and newborn care. That's not required in plans that you purchase yourself, but in these plans it's going to be required, as well as for employer-based plans. Now that's going to be a requirement. Mental health and substance abuse disorders are also required to be covered, as well as prescription drugs, rehabilitation, laboratory services, pediatric services. And the other expansion that really is coming through the Affordable Care Act is really the focus on prevention. So really preventive services and coverage for chronic diseases are also being covered. In the past, many plans didn't cover preventive services. They thought by the time someone gets a disease, they might be on another plan. Why do we want to pay to save another plan? So they didn't cover those services. But there's definitely a need to cover preventive services. And we're happy to see that coverage. Actually, in the U.S., about 75% of healthcare funding is spent on preventable chronic diseases, things like diabetes or cardiovascular disease or complications due to obesity. And the ability for healthcare providers to catch these early is critical. The Center for Disease Control issued a report that for every dollar spent on prevention, it saves the healthcare system $5.6. It saves money for those individuals also, as well as improving their lifestyle. They also said that about 50% of adults in this country actually have one or more chronic diseases. So that's 133 million Americans living with a chronic disease in this country. So with the focus on prevention, hopefully it will allow us to catch many of those diseases early, and will save not only money, but will improve the quality of life for many individuals. At a recent event that was happening at one of our partner hospitals, there was a gentleman in his 50s that came in to ask about healthcare insurance. And he said, he tries to stay active, he runs, but he hasn't had healthcare for quite a while. And so he said he used to love playing basketball. And that was one of the ways that he kept active. But he actually stopped playing basketball because he was worried that he might get hurt, and if he's hurt, he wasn't sure how he would actually pay for a hospital bill. So he stopped playing basketball. But that day he actually came in, signed up for insurance, and is another person that on January 1st is going to have coverage for himself. So, this focus on healthcare insurance will also help people. We want them to stay, people to stay healthy. We want to prevent chronic diseases, and it'll allow us to do that. So what is Enroll Lake County? What are we doing? So, we're excited that we're participating and kind of leading this effort in Enroll Lake County at the health department, but we couldn't do it without a community of strong partners. When we thought of this, we realized that the first group that we wanted to reach out to was the Alliance for Human Services. The state had issued a funding opportunity saying we're going to have funding available to do this work. And we really, as a health department, thought this should be a community-based effort where communities kind of come together and go through that. So we reached out to John and his team, and they did a great job bringing their partner agencies together. And we had others that kind of came up, like Anne, and said we are going to participate in this. Through this, we had 27 different partners. So there's 27 different partners that are actually signing people up for this service. And they're a broad range of services. So some of them are faith-based or civic groups. Library networks are participating, so people can go there. But we wanted to think who are actually reaching out to people, and those are the ones we want in our collaboration. There wasn't an application process. Any organization that wanted to participate, we said, great, come and you can work with us. So if you want to find a list of all those partners, like John said, they're there. But also I would encourage you to go to enrollLakeCounty.com because there's lots of resources on that website as well. And we try to make it easy so that you could refer others to that website, as well. I know a lot of you have heard about some of the challenges with healthcare.gov, and I'll be the first to admit we've had lots of challenges as we've gone through this. But luckily, one of the things that has happened is the state, when it expanded Medicaid, actually did it as its sole is running the program by itself, so it's not going through the federal marketplace. And in that program, a report was released today by the Kaiser Health Foundation that over 30,000 applications have already been submitted through the state application process, so that's exciting to hear that. I'll be more excited when I actually hear our numbers, because I think they're probably really good, but we haven't gone down to that level, so hopefully we'll be able to get them soon. But in Lake County, we signed up. So far, we have over 60 people that have completed, their training, of which 20 of those, are volunteers. And just to give you a sense of what the training requires, it's pretty comprehensive. So there is a state-mandated online training of 4 hours. Each person has to go through 2 days of in-person training through the state program, and then they're required to complete 20 hours of online federal training as well. Then they need to pass a background check, and then they can be apply to become a certified counselor. And that's important because we wanted to make sure that people really had the knowledge of doing this. Those that have gone through are really excited, but also realize there's so much that they probably don't know. So this effort really did come together with lots of partners. I want to personally thank Anne for her efforts. It's when I talk about trouble, she was kind of also helping us to push ahead, asking for marketing materials. Where are the training needs? We want access. She was really great at doing that. And out of those 20 volunteers I mentioned, her township has 18 of them. So it's incredible that people are signing, are volunteering to come and think they have to volunteer to do 40 hours of training before they actually even get to talk to that very first person. So the reason it's important, though, that everyone has that training is they'll be able to really walk an individual through what those options are. It's going to be a little, complicated to go through that process, and there'll be lots of options that they have. There's eligibility requirements that they'll have. They may apply for one of the programs, either the state program or that. So they'll be able to kind of sit down, walk through them. Our goal in our enrollment approach is really to enroll clients through those 27 different partner agencies, to kind of reach out to those that are interested, so those that are asking us questions. And then our third approach is really those that aren't asking us questions, that need insurance. So those that are in that 71,000, how are we reaching out to them? So what we've done thus far is we've established 2 regional hubs, one in the north in North Chicago, kind of for the eastern part of the county, and one in Round Lake for the western part. As I mentioned, we have over 60 people that are trained to do this kind of work. There's 24 different locations where people can actually go up, get education, enroll. On the Enroll Lake County website, which we established for this, you're actually able to look at a map. So, and in that map, you can put your address, and it'll tell you the closest location for you to sign up, and all the other locations. It'll also give people information very specifically about when that location is open, what are the hours, do you need an appointment for that? Do they speak other languages? For example, are they bilingual? Do they have Spanish speaking options there as well? So that site allows people to see all of those locations. And it also tells them if you need an appointment or can you walk in, which is definitely important for people to know. And then it gives them contact information for that. The nice thing is that I realized today, I searched for it, I had looked at it before, but I realized it actually gives them directions too, which I thought was kind of interesting. The other thing we're doing is spending a lot of time doing these outreach, events just like this. So, whether we reach out to people that have insurance or know someone that have insurance, we want to do that. So far, we've been able to reach out to about 5,000 individuals to talk to them about coverage. We've individually educated over 1,000 people through all of our partner agencies, which has been great. So we're definitely, are on our way. In the last couple of months, it's been interesting to see how this is going, and I know we're getting much more, speed as we go forward. But, when people were asked who do they want to hear about insurance from, they named 3 groups that they want to talk to them about coverage. So the first was they wanted to hear it from their doctor, so their provider. So we were reaching out to primary care groups, talking to them, doing education so that they know what kind of information they can give. They wanted to hear from community-based organizations. So we built that collaboration of 27 different partners that can actually reach out to organizations, or someone that maybe hasn't heard of that community organization can look online and find that organization and know where to go, where they might not have otherwise even stepped doors. And the third place, where's the third place, if anybody could think of that? The third group that they wanted to hear from is their mother. They wanted their mother to tell them about insurance, or at least do that. So I encourage anyone that's in that group, anyone that's a mother or a father, talk to others about insurance. But really, the reason that was important is because this is a big decision. For some of those people that are signing up for this plan, it may be the first time they're signing up for for an insurance plan, and so it's fairly complicated. So the work that the navigators are doing is spending a lot of time talking them and walking them through that really complicated system. So I encourage you, if you guys have anyone that wants questions, really go to that. Have them go to Enroll Lake County. They can find one of the locations. When I put in 700 North Sheridan, it told me the closest place that's not that far. From here, it's about 3 miles away, so it's pretty close for people to go to. So I would encourage you, if you have questions, definitely use that, that Enroll Lake County as a way to do that. So, thanks.
Our next speaker is Ann Flanagan-Bassey. She is the current supervisor of Moraine Township and a marketplace navigator.
Good evening. Thanks to you all for coming, and thanks to the League. Kudos to the League for always hosting these great events. There's a palpable hunger for people to understand the implications of this new law, opportunity, options, and how it affects them, how it affects their kids, how it affects their mother, how it affects, their neighbor and people they know. Tony talked about the navigators. We're fortunate here in Moraine Township. We're actually partnering with the Health Department and the Alliance to cover the entire Southeast. Our navigators will be working in the Shields Township office and the West Deerfield Township office and our office, and we're getting out in the evenings and weekends to the libraries and the high schools so that working people who can't come on Tuesday nights, there's a Wednesday night for them, and we're just trying to make it as easy as possible for people to sit one-on-one, because everybody we sit with has an entirely different situation. we haven't had a duplication yet, and they're so different from one another. We're going, well, where's the template to move forward? Well, there really isn't one, so it's on-the-job training. Whoever walks in our door, that's a new on-the-job training for us. We're fortunate because of where we live. You know, we all live in this incredible area where we have a pretty educated, sophisticated, professional group of residents. And we've been able to take the ones who have just retired. We've got a hospital administrator who just retired, a healthcare attorney, a head of nursing, a retired international banker. These people with incredible skills who have been used to doing service all their lives, because that's another part of where we live that we're so fortunate. And they stepped up and they went through this incredible training. The result, you know, for all of our effort, what we got was a piece of paper. And it said that we're certified navigators. And it does, Tony talked about, you know, the kind of effort that went into it. And one of the things that we're, in our outreach, trying to emphasize to people, if someone offers to help you, if someone offers to help your neighbor, your mother, your child, ask to see their credential. Because just like in banking and in taxes and any place else where people can find a way to get confidential information, you're going to sit with a navigator and share confidential information. You're going to share your social security number, your birth date, your income, and just the first thing we do when we start out any appointment is show our credentials. So, you know, help us spread the word about that. In our, you know, the reason navigators are useful and quite critical is because, I guess, if you figured out, listening to what's going on, this law is a little bit complicated, and everybody's situation's different, and we start with the knowledge base of what people have and the sophistication with, you know, online, you know, enrollment that they have, and try and work from there. But for some people, this process is daunting, even for people who are really good at one, you know, at a lot of different things. You know, this news thing is a little daunting. We do not make any recommendations to people. All we do is help them get through the process to understand the implication of their options. And we're going to go into that, you know, in good league fashion. I'm part of the nitty and the gritty of explaining really what happens when you get there. Just one thing about our navigators, we're taking appointments because we actually tell people what documents to bring in to make it go pretty quickly. We're taking appointments. We see people in our office in addition to our 18 minus 1 because you took Terry. In addition to our volunteers, I'm a navigator, our township clerk is a navigator, and our 3 staff, 2 of whom are bilingual, are all navigators. And we see people 8:30 to 4:30 in our office every day, and we're in the community weekends and evenings, at least one weekend day every week and one weeknight every week, and a different one. But we, you know, sit down with them and talk about, you know, we work through the process. I mean, the kind of people we help are everybody you run into every day. People who are unemployed, people who are self-employed, people who have jobs that don't have insurance, people who had existing conditions who did not have access to health care, people just coming off their parents' policies, people who retired early and aren't quite 65 and on Medicare. Obviously, with the township clients, a lot of our new enrollees are eligible for the expanded Medicaid, which was not available before to adults age 18 to 64 that didn't have dependent children at home. People coming off COBRA. In the past 2 weeks, we've had 2 women, 2 widows who came in who had been on COBRA, and they're coming off. So it's like when you walk down the street every day and you see people, those are the people who actually need insurance. And, you know, for the first time, many of them have this access to health care. As Tony said, there are a lot of, who was it? Guy from Florida. Ruben, yes. There are many factors that can no longer be premium drivers anymore. The only three that can drive a premium are age, which we really can't control. Location where you live, you can control it, but most of us choose not to. And smoking, absolutely controllable. Those are the only three things that can drive the premiums for healthcare these days. Tony talked about the essential health benefits. There are some here and there are some out on the table. We have all the essential health benefits that have to be incorporated into every plan laid out for you. So, if you want to pick one of those up before you leave. When we sit down with somebody, and I do have to say, yes, there have been a few. The marketplace is not exactly a well-oiled machine. So when we sit down with people, we may or may not get on to the marketplace that day. But we have reached the promised land a few times, so I know what it looks like, and I can explain it. We don't always get there, but we've seen it, and it's really, once you get there, really well laid out. When you put in all your information about income, it's going to determine, again, based on your income, up to 400%, whether you're eligible for subsidies, based up to 250% of the federal poverty line, whether you're eligible for cost sharing. The cost sharing will help you pay your premiums, your copay, or your deductible, not your premiums. The subsidies help you pay your premiums, I misspoke. The deductibles, the copays, the medications, for people 250% or below of the poverty line. But when you get to the marketplace, there are 4 levels of plans. And the levels are bronze, they're the metal levels, bronze, silver, gold, and platinum. And the difference in the levels is what percentage of when you access health care, the insurance company is going to pay versus you. Bronze is 60-40 for the insurance company and the insured, 70-30 silver, 80-20 gold, 90-10 platinum. You're going to want to look at it. Do I expect to be sick next year? Do I have a chronic condition I'm managing? Obviously, the less the insurance company pays, the bronze level, the lower it's going to cost. The more the insurance company pays, the platinum level, the higher the premiums are going to be. But if you're going to access a ton of health care because you are managing chronic health issues, then you're going to want to factor that in. If you're looking for subsidies, the subsidies are based on silver but can be used on any, if you're eligible for them, on any level. But if you're looking for help with the cost sharing because you're 250% or less of the poverty line, then you have to stay in the silver level to get that. You're paying 30%, but you're getting help paying the 30%. So, factoring that in, figuring out, do I want to roll the dice? Am I so healthy now that I want to roll the dice and just get a bronze plan and get my essential benefits and my, checkup every year and pay the small amount and hope I don't get in an accident or a major health. But remember, you can always enroll again the next year. And if you had a health issue that developed during the year, you can go change to a different plan the next year. There's a new open enrollment every year. So you get over to the marketplace and here's the promised land. So you look at the 4 levels and you decide, based on what you think you're going to need for health care next year, what level you're going to pick. So you can pick that level and you can just toggle back and forth and pick them all. But when you pick the level, it's going to tell you the plans that are in the silver level. And there is no small fine print here. There are going to be 3 big numbers. The first number is going to be your monthly premium. The second number is going to be your deductible. And the third number is going to be your maximum out of pocket for the year if all heck breaks loose with your health and you have to get hospitalized and, instead of the $200,000 you would have paid had you not had insurance, you get the, this is the most you will pay. And so you look at those, then a lot of people are going to want to factor in who their health providers are. If you have doctors that you really rely on seeing, if you have medications that are critical to you, there are, after the 3 big numbers, and you're going to sort through by, well, that's a low premium, but whoo, look at the deductible. Well, over here, there's also a thing that says, the essential benefits of that plan, and right below it is provider network. Some of the costs are being managed by insurance companies, by provider networks. They negotiate with a provider network to provide health care at a certain level. And so to the extent that they can get providers to agree to the lower billing costs, then they'll put that doctor in their network. And so every plan might have a different network. You can click on right here where it says, I say this like you can see this box that I can see, but over here there is a little thing, it says provider network. You click on it. You can sort by specialists. After you sort by specialists, there's an alphabet at the top. You click on my list, the name of my doctor ends with R, or begins with R. So you click on R and you look through every specialist that's in that, and you find your doctor, and it will say what plans that doctor is in. So if it's really important to you to see a certain primary care physician or a certain specialist, you can limit yourself to that network, to the network that that doctor has negotiated to be in. And the other thing that we found is interesting is, so let's say there are 3 plans that your doctor is in. There's a little box, there are 2 little boxes. One says save and one says click. You can click compare. Pick 3 plans and then hit the compare button. And it is at that point. While people have compared this to Travelocity, I've done Travelocity and I've done this. They're not the same, but in this sense they're the same because you can look across premiums, deductibles, maximum out of pocket, and every single benefit the plan offers will go side by side, and it's a nice comparison. What we had, because we have had people in several times and we haven't been able to work to completion with some of them, depending upon their level, and most of the people in this room are pretty sophisticated, just getting on healthcare.gov, which is also on this handout, and creating an account for yourself. And then putting in as much of your information as you can, just by yourself, your birthday, your social security numbers, your children, how many people you want to cover, you and your spouse, your kids, your income, and then, then making the appointment to come in, because if you're that far along, you just come in, log in, and then we can go there and we can, ask you the kind of questions that we think you may need to sort through your options. We won't make a recommendation. As a matter of fact, part of our training was a prohibition against making any kind of recommendation, but we can help you understand the upside and the downside of certain options and ask questions about what your situation is and what you expect it to be, over the next year to help you find what we think would be the best plan for you. And I'm going to stop now because I think most people really came here not to hear about the big picture, but to hear about how it's going to affect you, and you got a lot of questions.
Thank you, Ann. And I will open up the floor for questions. Just remember that this isn't intended as a discussion of the pros and cons of the Affordable Care Act, but rather your opportunity to ask our panel of experts about some of the options available under the Affordable Care Act. So, does anyone have a question? Yes?
Yes, I have a question in regard to the coverage provided for prescription drugs. I'm aware if you're, for example, if you're a Medicare Part D participant and you have an insurance program, the drugs that are covered and the amount of coverage are typically divided into tiers, tier 1 drugs and so on. And those various tiers are not identical from insurer to insurer. So for someone who's taking an expensive drug, it often pays to shop and enter in the whole litany of drugs that you take and determine which is the most cost-effective for you. How does that work for someone purchasing an Affordable Care Act policy?
Same way. Just like you want to check the doctors out to make sure the doctors are included in your plan, there's a way to investigate the formulary for the drugs and make sure that if there are certain drugs you are taking, you plan to take, you need to take, that they're included in your plan, and you can see the copay that you will be required to make for that drug for each plan.
Thank you.
Another question? Yes.
Having had a number of insurances over the years, I've discovered that I might know that I'm responsible for 10 or 20 or 30% of this particular amount, but I never know what that particular amount is going to be because different insurance companies have different contracts. Is there any way to know when you look at a screen like that what my percentages are going to be of? You know, to know who has the best contracts with the doctors.
I don't think so. Do you know?
So those contracts are proprietary between that insurance company and that provider, so they don't share them. They usually try to keep them pretty consistent, but you wouldn't be able to tell that this insurance plan versus this one, how much it would cost from your doctor. They would vary, but they're not public information, yeah.
I wouldn't be able to tell.
You wouldn't, yeah.
I know, I discovered that as I have different insurances. I go, well, this is a lower percent, but I'm still paying more.
You're paying more,
money.
right.
What is that?
Do you need questions repeated up here to pick them up for the cable? Okay, I'm sorry, I will try to do that. Additional questions? Yes.
I wonder, and I don't know if this is something you can answer, if an individual qualifies for Medicaid because their income is low enough to qualify for it, does the Affordable Care Act require them to take Medicaid, or can they still buy insurance?
The question is if an individual can qualify for Medicaid because their income is low enough to qualify, can they get insurance through Medicaid, or do they need to buy insurance?
Are they required to get?
Are they required to get
Or are they
insurance
allowed
through
to
Medicaid, or are
shop?
they allowed to shop through the insurance available under the Affordable Care Act?
They can buy insurance in the marketplace, but they will not be eligible for subsidies if you decline the Medicaid.
Other questions? Yes.
I have a more pointed question in this. You talk of maternity and child care, you talk of prescription drugs. Is contraception covered or that's not covered?
The question is whether contraception will be covered under the Affordable Care Act.
Yes, so it is covered. It's part of that maternity care, and the benefits and what levels could vary by plan. So certain, although they have to cover it, how much it costs for contraceptives, and that will vary just like other medications.
And there's no copay.
Other questions? In the back?
It's not actually a question, but it's a comment about the cost, the cost differences between different insurance companies. In my experience in Lake County anyway, the major providers of insurance negotiate rates that are fairly similar. So that if you do have like a 30%, many times it won't be a great difference between one insurance carrier and another in this area. I can't speak about other areas. But the negotiated rates, you always hear, for example, Condell not too long ago, a couple of years ago, was dropped from the Blues for a while. And that's because the Blues had certain negotiations and other providers in the area that they wanted Condell to basically have the same kind of provision. So I think if you're in this area, you're probably not going to pay a lot of difference with your copays.
I don't know if I can pick all that up for TV, but the point being that a lot of providers in this area, the copays seem to be similar throughout the area.
The charges that the insurance companies accept tend to be similar.
The charges from the providers that the insurance companies accept tend to be similar.
The allowable charges, I'm getting technical here.
Yes, the allowable charges per provider, correct, right.
And it's worth noting, when I said you want to make sure your doctor is in network, where you can really pay a lot of money is if you see a doctor that's out of network, then that you can pay, and the insurance company pays a much lower rate, and sometimes for some could pay nothing. So you want to be in network for your doctors.
And I must say that's true for hospitals as well. You want to make sure that they're all in the network. If you're
Good
gonna
point.
take a policy that only will pay the network your stated deductibles or your co-pays, then you better be in that network, or you're gonna pay a lot, potentially a lot. Because those charges are not negotiated as they are in network.
The point being made that you should stay also within your network for hospitals.
Or select an insurance policy that doesn't require that particular network for you to participate in.
Or select an insurance policy that doesn't require you to remain in network. Is that correct?
Or doesn't differentiate payments. Say your physician is not in that particular network, but the insurance company doesn't require a network for you to have that insurance policy, then select that one, if that's better for you.
Other questions? Yes.
I had a question about the open enrollment ends March 31st. And so the people that enroll on like March 30th or the middle of March, when do they expect to be insured then?
For the open enrollment, as
Let
long.
me just repeat the question. For open enrollment, people who've enrolled toward the end of the period, when would their insurance begin, basically?
Yes.
For every month. If you enroll the first 2 weeks of the month, your coverage will start the first of the next month.
Okay.
If you enroll the last 2 weeks of any month, it will start a month and a half away. So if you enrolled February 16th, you would start April 1st with your coverage, because you're too late for the March 1st.
Okay. Thank you.
Which is why, if you want to be covered as of January 1st,
December 15th?
you have to not only enroll, but the insurance company has to receive your first premium by December 15th, no later than December 15th for coverage to start January 1st.
Other questions? Go ahead.
What happens if you purchase an insurance policy under this Affordable Health Care Act and you're traveling? You're halfway across the country, let alone if you're overseas, and you become ill. How do you contact a physician in the approved group of physicians, or are you high and dry for medical coverage?
The question is, if you are not close to your network provider and require medical services, such as if you're traveling overseas or out of state, how do you access medical services?
I think, so some plans, most plans have some ability to actually, you can still get some payment. You'll probably have to pay more out of pocket, but that really is going to be contacting the insurance plan and see what the options are. And it'll mean you'll have to take your insurance with you and figure out what those payments structured, but they really are set up so that you can have some catastrophic, coverage if you have emergencies. But how much you'll have to pay, how do they get you back? That really does vary by plan.
And most plans, and again, Tony's right, it's insurance company by insurance company, but almost all plans, if you have an emergency and are not near, you're taken to the nearest hospital and it's treated as in-network. This country or another country?
In foreign countries as well as domestic?
Most, but verify it with your, when you enroll in the marketplace, it's called the marketplace, and the marketplace is a works with the subsidies and the cost sharing and helping people afford insurance. But truly, the contract is between you and a private insurance company, just like it would be now. So you can, before you hit submit, you can call up that insurance company, say, I'm considering enrolling for this plan, and ask all your questions. It is a private contract.
Thank you.
Other questions? Yes.
So the navigators are prohibited from making a recommendation, but is there anyone who can help someone determine what policy would actually meet their needs best?
The question is, if navigators are prohibited from recommending a particular plan, are there people out there who can basically recommend or advise you about which plan is best for you.
When I say we're prohibited from making a specific recommendation about a specific plan, maybe there was a misunderstanding. We are there to help you find, based on your circumstances, the best plan for you, and explain, why in your situation you might want to consider factoring X, Y, and Z into your decision. We can't say by this particular plan, but we can help you sort through the process. There are also brokers. Many brokers have gone through the training. The difference between the navigators and the brokers is we have no conflict of interest. And if you trust your broker and you've worked with them for years, they're going to look out for your best interest. It's just that we don't have a dog in the fight. And so we're a disinterested third party.
So second part.
Go ahead.
Then would be, for the health department and the providers who are members of the alliance, who will now be providing especially behavioral health, will you be able to point your patients and clients to a plan that you know works within your system or within that organization?
We've instructed our alliance members who have sent staff to become navigators that this must be a neutral process, that their client, their customer is the client, and we would expect that as the alliance members negotiate their own relationships with insurance companies and of course would wish to be accessible to those who have insurance for the first time, that must be absolutely separate. There cannot be any connection there at all. And we feel very strongly about that.
And what we're doing on the contracting end from the health department is we're looking at all those plans to make sure that we're accessible, that we have that coverage. So if someone's in our network, that they actually can stay, in our network. So we're working with the insurance companies. They haven't reached everyone, so even though it has the list of providers that are there, they got behind the 8 ball in terms of trying to register, so they won't have everyone there. But our goal is to have contracts with all of those insurance carriers so that if a person is one of our patients, they can continue to see us if they, selected one of those insurance plans.
I might add that one of the shortfalls in the press coverage, I think, is that you've all seen articles like in the Tribune talking about young people who have gone on the system and looked and seen very high prices. That never seems to include information about the subsidies and the help available to them. I've never seen any press on that. So it's important for young people to understand that that's just a gross price they're often seeing in newspaper articles.
Further questions? Yes, in the back.
You mentioned that one of the premium drivers is location. Can you give us an example of what you mean by that? What do you mean, Chicago area versus Albuquerque? Or
Healthcare is more expensive in certain areas, and there's rural areas where there are very few doctors, so it can be very expensive there. And on the other end, there's a metropolitan area where there are a lot of doctors and they make a lot of money. And then there's something in between. So the driver for location is what the average cost to access healthcare in that area is. And it's going to be different for rural, metropolitan, and in the middle.
The good thing about that is that insurance companies can't use artificial things to say, here's why we're charging you more, because there's this, because of these reasons. They really limited what the reasons that will affect on that. So although location, is in there, it's probably not the biggest factor. I mean, smoking and age are definitely the factors. Here it's not going to be. Location's not as big of a issue, but it eliminates all of the other reasons insurance companies can say, here's why you have to pay us, more.
Other questions? Yes.
For someone who's coming to this from the pre-existing condition era, I know you said we can find out if our doctors are going to be covered and if our medications are going to be covered, but how do we find out if our treatment centers are going to be covered? I have an IV that I need to do once a month. My doctor's office normally does it, but their nurse couldn't start
The question is for people with pre-existing illnesses who may require different medical centers in order to service their specialized needs because of their pre-existing conditions. How will they access those special service areas?
Medical centers, I think we talked about hospitals before, are also in or out of network, and you can find that out when you look at the plan.
You can also, I would encourage you to ask that center themselves to see if they know which plans they're on. The first person you talk to that's actually providing probably won't know which ones they signed up, but they could find out for you which contracts that they actually signed. So that's another way. When you already have that long-standing relationship with them, ask them, and they can also kind of help you to tell you if they're in that network.
Yes, in the back.
Can someone talk about pediatric services, particularly about eligibility for oral and vision care, which is something that parents sometimes don't realize.
The questioner would like you to speak about pediatric care, specifically oral and vision care available under the plans.
Up to age 18, it's part of the essential health benefits that are required for every policy. For pediatrics, not for adults, but for pediatrics.
Specifically oral care and vision care.
Dental and vision?
So are you talking about any kind of dental care?
For example, would braces be covered for children under the age of 18?
I doubt it. You would have to look at the plan, and again, the benefits of the plan you could see side by side, but it is unlikely, just like with most insurance policies, that orthodontics are covered as part of an essential benefit. But it would be covered under some plans, just like it's covered under some plans now.
I think the way to think about it is what's cosmetic in dentistry and what is kind of required. And so things like braces, unfortunately, are considered cosmetic and some of the other things. But, for cleanings and, cavities and things like that, those are items that are definitely going to be covered.
What about eyeglasses?
Yeah,
Question is,
For
what about
pediatrics?
eyeglasses for pediatric patients? Are those covered?
Yeah, I think you'd have to look at the individual plan to see what level of coverage they are, but vision is part of the plan.
Questions? Yes.
Very basic question. Do you have to live in Lake County to have access to the support you all are talking about?
Question is, do you have to live in Lake County to access the support you are all offering?
As a matter of fact, in Moraine, because we're not using taxpayer dollars, we're leveraging existing resources with our elected officials and our staff and our volunteers, we will see anybody in Illinois. So if you work in Lake Forest and live in Arlington Heights and it's convenient for you to come to our office, you're most welcome. Or to the Shields office where we'll have a navigator once a week, or to the Deerfield office where there'll be a navigator 2 times a week.
And I would just add that all of our sites will be open to welcoming folks, again, as long as they live in Illinois. We have a particular commitment to serve those who are our Lake County neighbors, but we're interested in getting all of our neighbors, even those who live a little further away, enrolled in the project.
Yeah. The one limitation I would say is obviously Wisconsin, right? Because the plans are just different. The Medicaid expansion, the states decide on their own. So other than that, which we have a lot of people that come into Lake County, but other than that, yeah, it's pretty open.
Other questions?
Melanie, I had three brief things I'd like to share. The first is that although I've lived in Lake County for over 8 years now, it's only through this project that I've come to fully appreciate the extraordinary services available to all of us and our neighbors through the Lake County Health Department, and would encourage you to become more aware of what's available and to the 45,000 people they serve every year. It really is remarkable. We are well served by that part of our local county government. Second, I'm pleased that we have with us tonight Terry Olean, who's newly joined our team as our project manager. Terry is someone who is well known to Ann and the Marine team and has come through that training process and volunteer process. We're so pleased that she'll be working with us going forward. So as we break and you want to check in with folks, she is another expert in the room. And then third, we're approaching this enrollment process in Enroll Lake County in some ways from the mindset of a campaign, and the League of Women Voters is no stranger to campaigns. We are anxious to get the word out and to connect in as many ways as we can. We have on the table outside a sign-up list for those who might be willing to be volunteers. We are creating ways to reach out to the community. We'll have special events. We'll be doing outreach events. We will look forward to inviting folks to be part of that effort, whether it's to help us stuff envelopes, whether it's to help us supervise a group meeting such as this, whether it's to do some other kinds of outreach. We would welcome your participation, and if you give us your name and contact information, we will keep that private, and when we have volunteer opportunities, we'll let you know what they are, and of course, you're always willing to, we would encourage you to opt in or opt out, whether your time or the task sounds like something you're willing to do. So please sign up to be our volunteer.
And if I could make one last comment, 2 of our navigators are specializing in the SHOP market. SHOP stands for Small Business Health Options Program. A lot of small businesses that have, 7 or 8 employees have been killed with premium increases of 25% a year if they have one very ill employee. The SHOP market allows businesses to get into a much larger risk pool. And, it's small businesses, it's your not-for-profit agencies that actually are generous enough to offer some kind of health benefits. And, our navigators in the SHOP market could sit down with a small business or a not-for-profit and take a look and see if they could find comparable insurance at a lot more affordable for them when they can get into a much bigger risk pool. And again, the pre-existing conditions for their employees are now off the table. So, that's just another thing to consider if you know small business people. You have to have at least one employee because the self-employed person would just be for themselves in the individual market.
Are there other questions from the audience for our panel? I'm going to ask just a question. When you were talking about federal poverty level, and can you put numbers to those levels and,
Yes.
and what they would qualify for, and maybe a number as to some of the subsidies that might be available for some participants?
Sure. Okay. The 138% of the federal poverty line, actually it's 133 with the 5% discard, but let's say a family of 4 would be about around 32,000 for a family of 4 would be eligible for the expanded Medicaid, but a family of 4 could make up to 94,000 and still be eligible for some subsidy. Obviously, the closer you get to 400,000, the less you would get in any kind of a subsidy. And the subsidy is calculated based on a percentage of your income. Depending upon your income level, you're required to contribute 2%, 3%, 4%, up to 9.5% of your income toward the premium. Then you look at the premium for the second lowest silver level, and that's a fixed amount. You deduct the fixed amount that you would be required to pay for your contribution, and the difference is a fixed subsidy that you can use for any level plan. So it is a calculation. Some of the others, for a single person, 200% of the poverty line is $23,000 approximately. For a family of 4, it's $47,000 for 200%, where you would be eligible for substantial subsidies plus cost sharing, up to 250%. I mean, if you want to give me your card, I have these pages that I could give you copies of just to show you how it plays out for every family level. But it is, it is hard to do medical care, housing, clothing, shelter, education at these amounts, which is why there is this measure called the federal poverty level, and there are ways to help people cobble together what's needed to sustain their family.
Do you want to mention afterwards, perhaps you could give that website link, the one link, is it on there?
Kaiser Family Foundation. That's the one you're talking about. Yes, the Kaiser Family Foundation actually, and you just Google it, has a subsidy calculation. And you type in, very good, thanks for reminding me, Terry, you type in your family size and your household income and the ages, and it will tell you what subsidy you might be available for, how much subsidy might be available to you to help you toward affording insurance.
But you could find that also on the website, if the website were functioning at this point, right?
Yes, yes. But it's easier to go to the Kaiser Family
Right now, the Kaiser Foundation's figured it out.
And
Oh, it
Does it?
does.
So until it's working, you can Google the Kaiser Foundation.
there's also a website I put on this sheet that we have found very useful. On days when we can't get to the marketplace, it's valuepenguin.com. And what it is it mimics the marketplace. So without creating an account, without putting your income in, you answer a few basic questions, and it will show you the plans that are available and how much they would probably cost you based on the number of people in your family and the ages in your family. And it's very helpful for actually getting to the plans on days when you can't do it through the marketplace, which we hope are very small numbered at this point.
So
Here, it's right on here.
if you pick up this paper, which is
There's some here and
outside,
there's some outside, it's all there.
that should be able to tell you. I think we've raised more questions now. Yes?
I'm confused by the metals, the gold, the bronze, the silver, and the platinum. Is there some simple way to describe what
It's here too.
is that?
It's essentially the bronze, when you access healthcare, your copayment is going to be 40% of the cost and the insurance company is going to pay 60. As you go up, you pay less, the insurance company pays more. So the platinum is 90-10, 80-20, 70-30, 60-40. And obviously, the premiums are going to be much lower if the insurance company's copay portion of the payment is going to be less. So the bronze levels will have the lowest premiums. Platinum will have the highest.
Yes.
My question has to do with if you can't access healthcare.gov to sign in and they say you can call, does that call mean that they're going to sign up for you, or does that call mean that you can get information but you still have to use the website to get an account?
Yeah, good question. So if someone wanted to sign up tomorrow, they can't get into the marketplace. Is there currently a way that they can sign up? Can they call and someone will sign them up by calling, or is it merely a way to access information by calling someone?
You can sign up on the 800 number. What is more difficult is visualizing your options and comparing them, which is actually why this workaround for the healthcare.gov site, when you can't get in it, is useful because you can look at the plans and kind of sort through them yourself. And the 800 number is also on here, and you can sign up on the 800 number. And I just don't think that you have the same ability to understand your options when you're making a phone call as you do on a website.
But an option might be to come in and speak to one of these very knowledgeable navigators who have materials that looks like mimic what might be on the website, talk to you, figure out which plan they want, and then dial 1-800 and sign up.
And we are seeing improvements, and we're optimistic that as the month of November moves forward, that the website will be more reliable. Keep in mind that one has up until December 15th to enroll, and as Ann said, make sure you make the premium payment to have coverage on January 1. All this is leading up to January 1. No one will be covered until January 1. And for those who are using the marketplace, there still is another 5 weeks. And so I think that depending on how you like to manage your planning and your anxiety about this, and I would give it a little more time and try for the for the healthcare.gov website and/or come in and meet with us, we're happy to help.
We actually encourage people to get as far along as the
Right.
process as they can because, they can access things at, 10 or 11 o'clock at night. It's hard to find a navigator to work with at that hour, sometimes. And so if you can get as far along as you can in creating your account and getting all the information in, then, your time with the navigator really will be time well used. Because you're actually going to be, instead of doing the routine perfunctory, input, you're actually going to get to the analysis.
And I think, for many people, it's a big decision. So, whether you do it on the website or you do it, by calling or however you want to do it, a lot of individuals aren't making that decision when they first go through those options. So, Ann is right. If people can kind of look at them, see what their options, they have a better framework when they actually come to make their, decision. So if they sit down with the navigator, they've already started to think about this. They know how much they're going to budget. They have an idea of really what that means. And so I think using a lot of those resources is helpful because it allows them to understand and have that conversation. We've had a couple of people that haven't done that. They've gone through the process, gotten to the end, and then said, I need to come back because it is such a big decision. They want to make sure they make the right one. So these options, I think, help people quite a bit as well.
Are there other questions in the back?
Yes. So these little cards with the lifesaver on them, that has your phone number on it, so once people have gone to the website and then they have a question, they can call you using this phone number and help figure it out, right?
Right.
We have time for one or two more questions. Yes?
How long the subsidies are scheduled to continue?
How long are the subsidies scheduled to continue?
To the best of my knowledge, there's no sunset date. They are funded by revenue that has been written into the Internal Revenue Code that does not have a sunset date. So obviously there can be an act of Congress, but there are no sunset dates written into to the subsidies for this legislation.
There are surcharges that are being implemented to pay for the program through income tax, 3.8%.
Well, there are 4 or 5. There are 5 that I can think of off the top of my head revenue sources. There is the 3.8% tax on investment income for high income taxpayers. There is a 0.9% Medicare surcharge for really high wage earners, extraordinarily high wage earners. Starting January 1st, there will be a payroll tax for employers and employees, a fixed amount. I think it's $4 per employee that will go into effect January 1st. And then there's the medical equipment tax. And, so
That's for employers who employ only a certain number of employees, isn't that correct?
I think that's for every employer.
Every employer?
The penalties are.
I think it's for every employer.
Any other questions? Well, thank you. I hope that you have found this to be an informative program sponsored by the League, and thank you to the League for bringing this expert panel together.